So as you can see, this webinar will be focused on the Victor's clinical history. Victor is one of the 4 cadavers present inside the anatomy table. And what I will discuss with you today are all the diseases and the pathology that affected Victor and that can be seen, are visible watching the data set of Victor from the anatomy table. All the diseases and the visualization that I will show you today, you can find it inside this folder called the presets annotations that you can find on the desktop or of your own table. If you open this folder, you will see that there is a list of different presets in the VPF format and 3 different folders. If you click inside the clinical presets folder, you can find the PDF related to the 4 different cadavers of the present inside the table, and 4 different VPF with the list of all the presets related to that specific cadaver. Okay, so let's start the webinar and let's open the table. Okay, so this is Victor. It's the female full-body Asian present inside the anatomy table. This is the default visualization when you open this particular dataset. Victor died at 33 years old due to pneumonia. Although his main disease and pathology was the leukemia. He weighed 55 kilograms and he was 1.71 meters tall. The pneumonia was caused probably for the leukemia, and the pneumonia was his fatal disease. If we open and we focus the attention on the respiratory system by opening the visibility dialog, deselecting everything through this circle and activated the respiratory system and the skin in transparency, we can focus on the lungs, and by rotating the body, we can clearly see that the pneumonia had caused also a pneumothorax. The lungs indeed are or collapsed. We can see it from this visualization, from the 3D view, but also by opening the 2D visualization. So the 2D original images taken of the cadaver. And if we tap on one of the 2 lungs, we can directly see on the 2D visualization that how the lungs were collapsed. In fact, you can see here in the 2D images the contour of the lungs, and by scrolling through the 2D visualization, you can see the little volume that they occupied inside the body, so the collapsed lungs. I can do the same with the other one. And I can see how the morphology is a pathological one. I will go back to the 3D visualization. And another way to see the collapsed lungs and how these lungs were pathological can be by comparing with the same structure of another body. In this case, another data set. I will open the lungs of Vicky, the female Asian body. So let's minimize the application and let's open another data set. So Vicky. In here, I've already put the skin in transparency and activated only the lungs. And already from a first sight, you can see the difference qualitatively between this structure, so the lungs of Vicky, a physiological lungs, and the one of Victor. But to have a better comparison, we can use one of the feature of the table that will divide the screen in two. And you can do this by opening the settings, layout, and by selecting one of the layout options, the one with the arrow that points to the right. In this way, you will put this particular window on the right part of the screen. Let's do the same with the other application. Settings, layout, and the same arrow that points to the left. So here is the final visualization in which you can have a direct comparison between the same structure, so the lungs of two different bodies. Let's rotate a little bit both the volumes to better see what the collapsing of the lungs meant. If I move a little bit the windows, I can also use the pen tool to draw different arrows to highlight the part of the structures that I want to focus on. I can do the same with Victor. Okay. And here is the final visualization with the arrows that points to different parts of the lungs. So in this way, you can use this particular feature of the table to create a different type of visualization that can be useful for an explanation or to see the comparison between a physiological volume and a pathological one. Okay, so let's minimize Vicky's body. And let's go back to the original visualization of Victor by opening again the settings and I will go back to the layout and deselect the visualization with the icon with the arrow pointing to the left. So again, the table will occupy both the screens. I will remove then the arrows. Okay. I will remove then the arrows by opening again the pen tool and using the tool clear and clear all the drawings. Let's see what can be another effect of the leukemia, because we have seen the first one. We've seen the first one, that is the pneumonia and then the pneumothorax. But if we focus on the digestive system now, in particular on the liver, by opening again the visibility dialog and selecting the liver, we can see from a first sight how the liver has an abnormal dimension. This is due to the fact that another disease that affected Victor was the hepatomegaly. The liver, due to the fact that it was forced to dispose more cells than usual due to leukemia, led to a dysfunction, and that brought to a abnormal dimension and size of the liver. We can quantitatively indicate the abnormal dimension of this organ by using one tool of the table that is called the measurement tool. And here, this icon, if I press on the icon, I can open different type of measures. I will use the first one, the linear one. So to use this tool, I have to press on the point that I want to measure. And in the case of the liver, I will measure the transverse diameter, the maximum lateral diameter, and the maximum vertical diameter. In this case, I will have displayed the different values of these diameters. And if you keep in mind this value, we can see the difference between the liver of this body, so Victor, and the one of another cadaver of the table. In this case, I will take as comparison Carl, that is the male Caucasian body, to do a direct comparison between his liver and the one of Victor. So let's minimize the view. And let's open another view of the table. Here I've already opened Carl, that is, as I mentioned, the male cadaver. And I've already put the skin in transparency and activated the liver. From a first sight, you can see the difference in dimension between this liver and the one of Victor. But let's take some measurement tool. So again, with the measurement tools, I will measure the transverse diameter, the maximum lateral diameter, and the maximum vertical one. if you have kept in mind a little, at least approximately the measurement of the other lever, you can see clearly the difference in dimension of the two structures. Let's go back to Victor. And let's remove the measures. To do so, I will open again the measurement tool, and pressing on the last icon, I will remove all the measures that I have taken. Okay, when the liver function in a body is compromised, the splanchnic circulation that is distributed to all the abdominal viscera is compromised too. We can see that by activating different type of vessels that are connected to the liver, but also that irrorate all the abdomen pelvis area. So let's open again the visibility dialog, and let's activate on the cardiovascular system the great vessels and some arteries of the abdomen and pelvis. In particular, I will activate the common hepatic artery, the proper hepatic artery, and the other. The two renal arteries, and the celiac trunk. And so I will activate then also the veins of the abdomen and pelvis. In particular, I will activate the two renal veins, the hepatic portal vein, and the two hepatic veins. From this visualization, I can see the splanchnic circulation. If I activate the blood flow, so the blood flow tool that I will activate from the Explore tool, the one in the middle, and I select the great vessel, I double tap on it, I can see how this circulation are connected to the kidneys and interest also the abdomen and pelvis area. Again, I can do the same with the veins. And I can see the connection between these deep type of structures. This means that if the splanchnic circulation is compromised, there may be cause changes in the blood flow and in the blood vessel volume that led to the kidneys. Let's activate the kidneys and let's remove the liver. And let's put in transparency the cardiovascular system. I will also remove the skin. So in this way we can focus on the kidneys and what can be the effect of the hepatomegaly on that. I will, if I want to see the kidneys, so the structures from the intern, what I can do is to apply a cut. In particular, we apply a frontal cut. And using the slider bar, I can move to the internal part of the kidneys to have a different visualization. From this view is clear the presence of the necrosis of the kidney that are marked from the pallor of the cortex of the kidneys that is in contrast with the darker areas of the surviving medullary tissue. They will highlight using this pen tool. As you can see, what I wanted to show you is that you can start from a disease, a pathology of the body, for example, in this case, Victor, and by using the table and different type of visualization, you can progress and try to understand what were the effect or the cause of this particular pathology. In this case, was the leukemia. Let's now focus on other congenital pathologies that affected Victor. For this reason, I will open the high resolution regional anatomy of the heart of Victor. So let's move to the heart. In this visualization, I've already opened the high resolution dataset of the heart. I will show you the path. So I will open the menu. By clicking on the high resolution regional anatomy button, I will select the desired dataset, in this case, the heart of the male, so of Victor. Once opened, this is not the default visualization, but I did another step. So by opening the layout icon, I selected the second option that let you compare the 3D visualization on the right part of the screen, on the left part of the screen, sorry, with the 2D visualization and the 2D original images on the right part of the screen. From this view, what I wanted to show you is the congenital patent oval foramen of Victor. At this level, in particular, you can see on the right part of the screen, so on the 2D images, that here there's still a hole between the right atrium and the left atrium. Let's annotate them. So I will use the text to enter the annotation for the right atrium. And the left one. So what the patent foramen oval is a hole between the left and the right atrium of the heart, and it's a hole that usually it closes before the birth, but most time often can be also remain open also after being born. It's common and it usually doesn't cause any symptoms so probably Victor was not affected by any disease or any symptoms by this the presence of the patent foramen. What he may have had was maybe some migraine or headache. So this visualization with a 2D can be interested also to show this type of congenital diseases or pathology. To do a comparison between a pathological heart, so with this particular congenital disease, and one without this the presence of the foramen, we can use or another cadaver like we did before, or another thing that we can do is to compare this visualization with another type of data, the one that that provene from a patient. So in this case, I will, for example, open one of the DICOMs present inside the table. So let's open only the 2D visualization, and let's change the type of cut. We'll go back to the actual view. And stop at the level in which the patent foramen is visible. I will again minimize this view and open a DICOM. I've already opened a specific DICOM, that is a TAC of a patient with a physiological heart, so without any disease, but this TAC was acquired in order to see the presence of a sternal foramen. You can find this information for each DICOM you open with the table by opening the icon, so the information icon, in which you can find the name of the DICOM, in this case sternal foramen, and some details about the patient. Since I want to compare two different similar visualization, I will, for the moment, I will focus only on the 2D visualization, so on the 2D original scans of the CT. I will select the third option of the layout icon, move a little bit the scan, adjust the brightness, and move through with the slider bar to see the point in which I want to focus for the patent foramen. Again, like I did it before, I will select the settings and put through the layout the visualization on the right part of the screen. And I will do the same with the other view that I've opened before, and selecting the settings, I will put that to the left. Through this visualization, it's easy to do a comparison between two different types of data, so one obtained from a cadaver and one obtained from a patient, but also two different similar visualization and two different similar same structure, but one pathological and one physiological. So here you can see the presence of the layer of structures, and here the presence of the patent foramen. I will go back to the original visualization and remove the comparison. And from here, I will now focus on the 3D. The 3D original reconstruction of the scans. As I mentioned before, the main purpose of these CTs was to visualize the sternal foramen of the patient. To better see some particular structure, in this case I want to see the sternum and the rib cage, I will adjust the brightness and contrast, and I can also change the type of filter. To do so, I will open the visibility dialog here, the eye icon, and select, for example, one on the ultra high quality renderings to have a more photorealistic visualization. In this way, I can clearly see the presence of the hole of the sternum, and I can also highlight it with a pen tool or with an arrow. Here. We are talking about this sternal foramen, and we can think to do again a comparison between this type of data with a patient and another one from a cadaver. Remaining on Victor, so on the structures of Victor, I can see that if he has had he had the sternum foramen. So I will open the high resolution regional anatomy of the thorax of Victor by minimizing this view and opening another visualization of the thorax. So as you can see, I've already opened it, and this is the default view, but to do so, I will show you the PET again on the high resolution regional anatomy section. You can find the thorax male dataset. From this visualization, we can see that the presence of the sternal foramen also here in Victor, and we can focus on it and highlight it again using the pen tool or an arrow. Fortunately, the sternal foramen didn't cause him any symptoms because it's mainly asymptomatic and also really common in almost 5% of population. I've shown you different type of way to do comparison between different type of data. I want to show you the last one, another option that you can obtain by opening the layout and selecting the fourth option. By doing so, the table will be automatically divided in two different screens, and by tapping on one of the one structure on the 3D, it will by default open an histology of the same tissue as the structure that you have selected. So in this way you can do comparison between these different type of data. What I wanted to show you is that you can do it also with the DICOMs, so with the third option, and you can open the menu and select the same, for example, the same DICOM that we have opened before. If I open it in here, I can have a direct comparison by changing the brightness and contrast between two different two different data belonging to different a patient and a cadaver, but having the same type of pathology, sternal foramen. So the webinar is over. The explanation is over. If you have any question, please feel free to write on